Thank you very much for arriving on time and helping get our conference started. My name is Stephen Holgate. I'm a Medical Research Council research professor in Southampton University and a physician at the hospital in Southampton. I'm not a specialist in chronic fatigue syndrome or ME, though my interest in the area began because I started seeing patients in my allergy clinic, hence my involvement in it. But I'm not an expert, so like some people in this room, I will be learning a lot from what you're all saying today, and I look forward to the next couple of days' discussion. Before we get into the sort of introduction of the conference, I just want to give you a few housekeeping notes. Firstly, no fire alarms are planned, so if you're hearing the fire alarms, they're real. And we've got to make our way to the point outside. Sonia, we've got notices on the doors, haven't we, which identifies, and we'll be led out down the stairs. Secondly, obviously the place where the toilets are is very important, especially when you get to my age. So out the door, left, and at the end of the room, so that's fine. Mobile phones, please, off, especially since we're going to be doing some filming during this conference. So it's quite nice to not have mobile phones going off all the time. So if you wouldn't mind putting them on mute, I'll turn them off. Posters will be in this room during the conference when we have the poster sessions, and the abstracts of those posters are at the back of your program. The workshops tomorrow don't require anybody to sign in. There are 3 workshops tomorrow, so you just have a look at those and find out what you feel would interest you most and attend it accordingly. And if there's any questions during the next 2 days about the organisation or anything else, we've got people here from Action for ME, and thank you volunteers from Action for ME, and thank you Sonia for helping with providing information should you require it. They've got black lanyards on, like I've got on, but I'm not from Action for ME. Right, so that's the housekeeping. In your file, you'll have 3 documents. One is the program, and that program also has got some descriptors about the 2 charities that contribute to our efforts, so thank you for that. Secondly, you'll see a description of an international alliance with some introductory comments, which Sonia is very involved with. I'd be very grateful if you'd have a look through that, and if you feel you can sign the principles outlined in that document, that would be wonderful, and give that to the desk at the end. And thirdly, you will find in there, I think, further information about various activities that relate to where we're going in the future. Now, let me just, for those who really don't kind of understand what the CMRC is, the UK CFS ME Research Collaborative is. We began 5 years ago, and you'll notice we're at our 5th conference, which is, I think, a point to celebrate today and tomorrow. So the reason we did all of this 5 years ago was because the field was going this way, that way, and every way, and everybody was doing different things, and there was no forum for bringing researchers together to discuss directions of travel and where the efforts should go to try and increase knowledge in this field. So I thought it was important we try and do this, and with the help of the charities and with various organisations who you'll see in that circle there, over the years we've managed to put together, I think, a robust organisation now which speaks in many ways for the research voice in this country, in this particular field. Not saying that all the individual organisations don't do a lot as well, of course they do, but we've got to start speaking with a single voice if we're going to influence change at a national level, and that's really the reason why we got ourselves going in the first place. The important thing about the collaborative is that it's got to be a collaborative. People have got to work together, and a big change that happened in January of this year when we were reviewing our sort of 5-year progress was to think about involving patients and carers more in the way we run our direction of travel. And so we're absolutely thrilled that the Patient Advisory Group has joined us, and I'm pleased to say that that group has made a marvellous contribution over the last 6 to 9 months, and thank you all very much for all your efforts. It really has been tremendous, and I'll touch on what you've done in a minute. And to say that We're looking for 7 new members of the patient advisory group, and an advert will be going up on the websites for the CMRC, which are hosted both by Action for ME and for the ME Association. So please do access that if you're interested in volunteering or putting 1 or 2 names forward for people who might contribute to the patient advisory group. So in January we had a kind of a navel gaze really about what we'd achieved over the last 4 or 5 years, and though we had achieved quite a lot, there's no question about that, and we had 4 very successful conferences, and I think that's been marvellous. We did realise that we really needed to focus our efforts more than we had done. What we were doing previously, I think, was acting more as a broad church rather than concentrating efforts on what really needed to be done to make a difference at the moment in time, both in politics and in science. So with that kind of 4.5-year period coming to an end, Chris Ponting, who is now Deputy Chair, very kindly agreed to take over the role and has helped us enormously in setting the agenda really in a new scientific journey for us in this field. And that scientific journey is really to expose discovery to try and understand causative mechanisms of this disease. And although we'd started that process 2 or 3 years ago and had a few attempts at trying to get it supported, we really hadn't concentrated on it. And I think that's the point really. We've spent the last 9 months really concentrating on that particular effort, and it's really beginning to, I think, gain traction now and reap some rewards, we hope. So let me begin by saying that earlier this year, Alex Riberoff, who some of you will know, who has 2 children who have had chronic fatigue syndrome and ME, and one still does have it, really arranged a meeting with Jeremy Hunt, the then Minister of Health, raising concerns about understanding in this disease. And he and his family, I have to say, have been absolutely brilliant. And I'm sorry they're not here today in a way, because I would thank them personally. But after the conference I will, because Jeremy Hunt, the Minister of Health, really listened to him and his family, which was fabulous, because there were patients, just like many people in this room are, talking to him. And as a consequence of that, the Chief Scientific Officer for the Department of Health, Dr. Christopher Whitty, invited us to go and speak to him. And Chris Ponting and I visited Jeremy Hunt and Chris Whitty to have a conversation. And it did seem as if the time was right, that the Department of Health was willing to think about doing more research in the area. So it's kind of the right time. So we had a subsequent meeting with them, and as a consequence of that meeting, we are, over the next year or 2, going to set up a research prioritisation exercise through the James Lind Alliance. And anyone wants to look at what the James Lind Alliance is, LIND, hosted by the National Institute for Health Research in Southampton. It's a prioritising exercise where patients, carers, professionals and clinicians get together and agree research priorities. That hasn't started yet, but the go-ahead has been given. So that's going to be some work in progress over the next year or 2, and very exciting because it will involve patients. Secondly, we approached the Medical Research Council at the end of our last meeting, saying that we wanted to try and really start getting some serious funding and support in this area. And as a consequence of that, we were invited, that's Chris Ponting, Sonia Chowdhury and myself, to present to the Population System Medicine Board at the Medical Research Council what our views were about this field and what needed to be done. And we had a very productive discussion with the MRC board at the time, and were asked a series of questions. And then the MRC took the messaging that came out of that discussion around its other 3 research boards, the Cell and Molecular Medicine Board, Infection and Immunity Board, and the Neurosciences and Mental Health Board. And they all came up with various questions about it all, which the MRC synthesized into a document which was sent to us to respond to. So over the summer, the executive of the CMRC, and thank you again for doing this, has helped Chris, Sonia and I frame a document in response to those questions, which has now gone back to the MRC again, and last night was acknowledged by them, So they will be looking at our response, and hopefully beyond that there will be further stages that will occur. And we were quite bullish in that response, in really hoping that this now is going to be the start of something really different and a different attitude. Whether or not it happens, we don't know. But we've done our very utmost to actually bring the thing to the cliff edge now, and let's just hope we can get into that next stage. It's an important moment because biology in other fields, like my own, asthma and allergic diseases, is moving ahead at a tremendous pace. And we feel that the biology being applied to these other complex diseases could fit well with this syndrome, which definitely needs a new approach to it. And in the United Kingdom here, we have with the National Health Service a wonderful opportunity of gathering patients together in this journey to start interrogating, using new molecular approaches, new pathways that might expose some of the causation of these dreadful symptoms that patients experience. So today and tomorrow, you're going to hear bits and pieces of various people's research, which I'm sure is going to be amazingly exciting. What you're going to hear is that real progress is being made. And I think that's the attitude I think we need to adopt today. And what's absolutely brilliant, as far as I'm concerned, is that other organizations are now beginning to take an interest in this area. So previously it's been the major charities, particularly the ME Association and Action for ME, that have driven the agenda. But we've been joined by Arthritis Research UK, which has just merged with its patient member charity, and they've got a new name, which we'll be hearing about maybe a little bit later on. But they've taken a real interest in fatigue as a symptom, and fatigue and pain, and maybe we'll be hearing a bit more about that later on. And later this month I take over quite a large charity called the Kennedy Trust Research Charity for Rheumatological Diseases. And again, they've expressed with AR UK some interest in wanting to think about fatigue as one of their priority areas as well. Now, I don't know where all this is going, but what I'm trying to say is that other organisations are beginning to express interest here, and that's terribly important if we're going to really get a joined up effort here in the UK to move nationally the agenda forward. So I'm very encouraged by that, and I'd just like to thank those that are helping us, particularly Arthritis Research UK and the new name, which I think is called Versus Arthritis, I think that's correct, to thank you very much for helping move this on. Now, the organisations that have helped support this conference are in fact the charity sector, who have been marvellous, the Medical Research Council, who have been marvellous, and UCB, a pharmaceutical company, who have also been very helpful. And I'm very grateful to them for helping fund some of the travel for the patients and carers to come here, for the travel for the speakers, and to help us with this conference centre. So thanks ever so much for that, and we'll be thanking you again at the end of the conference. Now, as we're moving forward in this way, and I'm not saying we're anywhere near the end of our journey yet, in the United States and in Canada, great progress is being made through the NIH. It started in 2015 with the Institute of Medicine, or the National Academy of Medicine as it's now called, their report that was published, which was a bit controversial over various names and things that were included in that, but it was a serious piece of work on the science behind this group of conditions. And as a consequence of that, what we've got now in the US are 4 centres that have been funded by the National Institute of Health, and as I understand it, have been refunded recently from the NIH. So we're hoping if we can get our ducks in a row here in the United Kingdom, then we will be able to link with the US and the Canadian efforts to try and form an international research effort here, so that we can swap information between ourselves and get added value by collaborating together. So we'll see where that goes. It's very much on the agenda, and we're very much in touch with the NIH and Vicky, who has been absolutely super there in helping us get the connection going between our US colleagues and here. So that's me done. I just wanted to say, I think 5 years has been a long time to get to this point, but I do believe now we're at this point, we're not going to go back. It's terribly important now that we bear down on what needs to be done. We speak with a single voice, and we make our pressure felt on the urgent need to get some new high-quality research done in this field to actually start beginning to uncover some of the complexity, which obviously has been a mystery for so many years.